Does your heart often skip a beat? Do your muscles frequently cramp? Is your thinking slower than it used to be? If any of these sound familiar, it might be because your potassium levels are lower than normal. This medical condition is called hypokalemia. About 98% of the potassium in your body is located in your cells, and that's not by accident. Potassium is an electrolyte, meaning it helps transmit electrical signals to your body's cells. Your body uses this electricity to maintain fluid balance, send nerve signals, and contract muscle cells, particularly those in the heart. Potassium helps keep your heartbeat regular, your kidneys functioning well, and prevents your sodium levels from getting too high. Potassium deficiency is more common than you might think. Studies show that 9 out of 10 Americans, upwards of 290 million people, are getting only about half of the 4.7 grams of this essential mineral they need each day. The normal range for blood potassium is between 3.5 to 5.5 millimoles per liter. Below this level, hypokalemia occurs. Extremely low potassium levels, less than 2.5 millimoles per liter, can lead to irregular heart rhythms and trigger cardiac arrest, which can be fatal. So, what causes potassium deficiency, and what are the signs that you might have low potassium? How can you replenish your potassium levels? This is what we'll discuss in the rest of this video. First, let's explore the causes of hypokalemia. Potassium deficiency is rarely caused solely by low intake of fruits and vegetables. The most common cause is excessive potassium loss through urine. This happens in people who take prescribed medications called diuretics or water pills, which make them urinate more frequently. These medications are often prescribed for high blood pressure or heart disease. Another reason for potassium loss is through the digestive tract, which may occur due to frequent vomiting, diarrhea, or laxative use. Other physical conditions that contribute to potassium loss include eating disorders like bulimia, excessive sweating, chronic kidney disease, other medications such as insulin and antibiotics, excessive alcohol consumption, and low magnesium levels. Next, what are the symptoms of hypokalemia? Often, the symptoms of low potassium are easy to overlook until they become severe. Let's start with our number 10, high blood pressure. High blood pressure or hypertension can be caused by excess weight, genetics, or eating a lot of processed foods high in sodium. Maintaining healthy blood pressure requires the perfect balance of electrolytes. Potassium and sodium are electrolytes that work inversely in the body. When you eat potassium-rich foods, your kidneys get rid of excess sodium through urine. If your cells don't have enough potassium, the kidneys reabsorb sodium back into the bloodstream, causing your body to retain more water. More water in the blood means increased pressure on your blood vessel walls, raising your blood pressure. Potassium helps to relax blood vessels and lower blood pressure. Next up, number 9 is irregular heartbeat. For most people, heart palpitations or an occasional skip beat are not a major concern. However, if you have low potassium levels, this can lead to cardiac arrhythmias or an irregular heartbeat, especially for those at risk of heart disease. This happens because low potassium levels alter the flow of potassium in and out of heart cells. As a result, the electrical signals that control your heartbeat don't work correctly, causing your heart to beat too fast, too slow, or irregularly. If you notice any changes in your heart rate, seek medical attention immediately. Coming up next, we have number 8, muscle weakness and cramps. If you frequently experience painful leg cramps, a lack of potassium might be the culprit. This is because you lose electrolytes, including potassium, after intense exercise. Potassium is important for muscles as it helps transmit signals from your brain to make them contract. It also helps end these contractions by leaving the muscle cells. When blood potassium levels are low, your brain cannot transmit these signals as effectively. This can be a problem for athletes, as it can lead to reduced blood flow and issues with muscle contractions. Cramps are less likely with mild or moderate hypokalemia, but they may occur if potassium levels drop below 2.5 millimoles per liter. Therefore, it's recommended to take electrolytes before, during, and after strenuous exercise. Our number 7 is weakness and fatigue. A lack of potassium can lead to weakness and fatigue for two reasons. Coming up, number 6 is digestive issues. Low levels of potassium can cause constipation. Potassium helps relay signals from your brain to the muscles in your digestive tract so they can contract and move food along. When potassium levels drop, these contractions weaken, and the movement of food slows down. If potassium levels drop too low, the intestines may stop moving, leading to nausea, vomiting, lack of appetite, bloating, and abdominal pain. Are you finding this information helpful? Be sure to like, share, and subscribe, and click on notifications so you never miss a video. Next on the list is number 5, frequent urination. Low potassium levels may prevent your kidneys from concentrating urine and keeping electrolyte levels balanced. This can lead to excessive urination, polyuria, and excessive thirst, polydipsia. Excessive urination can further lower potassium levels. Seek medical attention if your urination frequency changes suddenly. Next up, number 4 is tingling and numbness. Low potassium levels can weaken nerve signals, leading to tingling and numbness in the hands, arms, legs, and feet. This condition is called paresthesia. Sitting in an uncomfortable position might cause tingling and numbness, and is usually not a cause for concern. However, when these symptoms persist, it's time to seek medical attention. Getting into our top 3, number 3 is breathing difficulties. If your blood potassium levels are severely low, it can cause shortness of breath by restricting the expansion and contraction of your lungs. This is because potassium is crucial for sending the correct signals to the lungs so they know when to contract and expand. One study found that people with low blood potassium levels or high blood potassium levels, hyperkalemia, were at a much higher risk of respiratory failure and needing a ventilator in the hospital, compared to those with healthy potassium levels. As mentioned earlier, low potassium levels can cause an irregular heartbeat due to faulty electrical signals in the lower heart chambers. As a result, the heart cannot pump enough blood to the rest of the body. Less blood means less oxygen is delivered, leading to shortness of breath. Number 2 is brain fog and mood swings. When potassium levels are low, the neurons in your brain cannot fire electrical signals quickly. This results in confusion, forgetfulness, and difficulty concentrating. A lack of potassium can reduce blood circulation and disrupt hormone production, including the mood-regulating hormone, serotonin. A potassium deficiency may manifest through significant changes in mood and behavior, such as increased depression, anxiety, or irritability. And at number 1, we have kidney stones. It is estimated that over 1 in 10 people will develop a kidney stone in their lifetime. If you develop kidney stones, they may be a sign of low potassium. In one study published in the New England Journal of Medicine in 1993, men who consumed less than 2.9 grams of potassium daily were twice as likely to develop kidney stones as those who consumed over 4 grams of potassium daily. Kidney stones are hard masses of minerals and other substances that form crystals inside your kidneys. These small stones are most commonly made up of calcium and oxalate. When these stones become lodged in the urinary tract and block the flow of urine, they can cause excruciating pain. Potassium helps your kidneys flush excess calcium through your urine. If you don't get enough potassium in your diet, this can cause these masses to form. So, how do you get more potassium? The best way to replenish potassium is to add fruits and vegetables to each meal. This includes bananas, but there are plenty of other foods that contain potassium. You can find it in whole foods like leafy greens, tomatoes, cucumbers, zucchini, eggplant, avocado, pumpkin, potatoes, carrots, raisins, beans, dairy products like milk and yogurt, meat, poultry, fish, and nuts. Your doctor may prescribe supplements if you have a medical condition or are taking specific medications. If you decide to supplement with potassium on your own, consult your doctor first. As always, this video is for educational purposes and does not constitute medical advice. We are not doctors. I hope you found this video helpful. And now, over to you. Do you have symptoms of low potassium? Let us know in the comments below. We'd love to hear from you. And click on the link below to get your free anti-inflammatory diet plan.